Our upcoming agenda that we're going to be dealing with on October 2nd. So let's go ahead and get right into it. The first thing we have is a presentation about an important day coming up, which is our National Night Out. Victor Turner, I understand you're going to tell us about the 25 different locations we've got that in the city that are going to be hosting activities to celebrate National Night Out.
Yeah, good evening, board, mayor, members of the board. National Night Out, I know City of Little Rock has been hosting events for as long as I can remember, but it actually started in 1984 with just a few communities, and now it's grown to over 16,000 communities and 38 million neighbors participating in the event. And we always look forward to it. It's an opportunity where you can see the various departments working with each other, police and fire and housing and our code enforcement people in particular. Scott. This location is at Wright Avenue last year, and one of the reasons we have National Night Out is to raise awareness about crime, but also bring out nonprofit organizations and community-based organizations to share information with neighbors about how they can improve their community and better educate them about resources that's available. As you can see, these are some of the partners that we have. Of course, neighborhood associations play a vital role in carrying out National Night Out events. Our police department, particularly the community-oriented police, are very involved, and then as well as some of our nonprofit organizations. I mentioned, community volunteers. Annually, we have about 2,000 residents and volunteers that participate in National Night Out. It varies from location to location which ones have the biggest turnout from year to year, but overall we have a consistent attendance from year to year that's around 2,000. Some photos from some of the participants. Our LRPD are very involved. Here's a photo of fire department, police, and a code enforcement officer at one of the events, and also the fire department truck and a mounted officer. As the photo on the upper left, that's from the East Little Rock event from last year. One of our, well, actually the president of Neighbor Connections in that photo, and also Taekwondo group performing. And as I mentioned, it's a collaboration between various departments, and the primary goal is to raise awareness about crime and hopefully stomp out crime in our community. The mayor mentioned 25 locations. I know there are, I believe, 16 that our resource specialists been working with, and at least another 4 that LRPD has been working with that are independent of our resource specialists working with. So about 20 total. And as I mentioned earlier, the event started in '84 with simply folks leaving their light on the porch. And now it's grown to block parties and all kind of community awareness events that we do across the country. And certainly Little Rock is always very active in participating in National Night Out. And I would encourage you all to try to make it around as you always do, and try a different location than you have in the past. One change, we have historically always had a event at the parking lot where Big Lot is. The University District location will now be at the Oak Forest Neighborhood Resource Center. Any questions?
Okay, well, thank you, Victor. Okay. This is a great opportunity to get out and about. Director Adcock and I always have a race to see who can get to the most locations. She consistently beats me, by the way. I haven't figured out how she does that, but we know she's very resourceful. I thought what I might do this time is just tailor and see if I can make as many as she does. So in any event, I knew there were a lot. So 20, and anybody can do that in about 2.5 hours, obviously has got wings to take them around. Okay, as you note, we got a couple of other announcements or proclamations for next Tuesday, one on planning and one on Fire Prevention Week, and we'll take care of those when we get there. We can turn now to the agenda, and you'll see that there's a request to add M1. If there's no objection, we'll add that to our ordinances. Mr. Carpenter, did you have a comment on that? I know
It's
she
not
just
on
turned
that,
your-
it's on number 11 in the consent agenda, Mayor.
Pardon?
My comment's on number 11 in the consent agenda.
Okay, well, let me turn the page and see if there's any questions about the first 5 items on the consent agenda.
I'd like,
If you'll,
I've been asked to, somebody's asked me about these Hamilton apartments, and I don't know anything about them.
which number is this?
2. So we can't get any information on it?
This is, Director Wright, just setting the date for October 17th on a Plan Commission, the denial of the Hamilton Apartments on Cantrell.
So at that public hearing, we'll be able to get some information on the denial and
Correct.
the objections and
Correct.
all of that? And that's going to be on,
October 17th.
okay. Okay.
Vice Mayor Webb.
Thank you. Can we get a presentation on 5? Or some information on it?
Certainly.
Let me ask our Planning Director, Mr. Collins, to come forward. Jamie?
Mayor, Vice Mayor, members of the board. Item 5 is a amendment to contract for Nelson Nygaard for the I-30 crossing project for their services needed for us, our representation in negotiations and design and build with the Arkansas Department of Transportation. That contract amendment will go through then the remainder of that design build contract.
Our original contract was, what, $100,000? Is this the third?
This is the third. The first one come before you in regards to development of what they call the white papers, or a document that spelled out the things that the city would like to see in improvements, for this I-30 crossing. The second one that come before you was a $50,000 contract for just ongoing as needed in negotiations, discussions with our agreement of understanding with the Department of Transportation. And that is coming to an end. We're concluding with that one in our final discussion. So this last portion is to take it through this unique design build contract with the Department of Transportation. This is not a design bid build, it is a design build. So their contractor, designer has not been selected yet.
When will we see their report from the second phase? Or that extension we did with the $50,000?
Oh, as far as the agreement of understanding, we're currently working through that. We met with Department of Transportation last week to kind of go through that agreement of understanding, and then we're working through the final agreement as far as the dollar amounts haven't been set yet. So we're looking to get that done probably before their final RFP that goes out for their design build contractor.
Can we hold this separately and not have it on the consent agenda, please?
Sure.
Thank you.
Very good, thank you. Okay, let's turn the page and see if there's any, Director Wright, did you have anything on that page? All right, go ahead, please.
Mr. Moore, we received some information, was it a week or so ago, that, about our insurance? So you're saying that everything is worked out? I thought it was gonna go up.
We're prepared to have our consultants, Stevens Incorporated, to come forward. We did an update to you all back a few weeks ago, just to let you know that we were going out for bid. Those bids have come in. This is a recommendation to go back with United Healthcare. We received a bid. We received 3 fully insured bids, and also self-insured. And after meeting with our consultants and reviewing the bids, this is a recommendation to go back with United Healthcare with a 2.5% increase. So there is some increase as far as the primary doctor's visits and so forth. But I'll ask Tom Kane to come forward. The one thing we are requiring of our employees is that you have to have a physical within a year. So starting July 1st of this year through the end of June of next year. And if you don't, then you're going to pay $25 a paycheck towards your insurance. So this is a way, and we've again been visiting with Tom and his staff to say that we want to ensure that our employees are getting their physicals so we can begin to develop data. So Tom, and then we'll be glad to answer any questions.
Okay, thank you, Mayor, members of the board. I believe we have a PowerPoint. We can get that up. First, I'd like to make a few observations. The initial renewal from United Healthcare was at 15.25%, and that obviously triggered an RFP. But the initial renewal from United Healthcare included claims history going back all the way into 2016. And to remind everybody, 2016 was not a good year. It was our first year with United Healthcare. We had a little over $13 million in paid premiums and over $14 million in paid claims. So that's a loss ratio of 106%. However, and I look at this every month, beginning in January of this year, things started to turn around. And May 2016 through June 2017, it improved to an 88% loss ratio. So we felt good going into the RFP with the claims ratio improving. And then if we just looked at the first 6 months of 2017, it was running at 76%, which is really, really good. So we released the RFP, and then in conversations with the other carriers, Blue Cross and QualChoice, we emphasized to them that we really wanted them to focus on 2017's claims history. That 2016 was an aberration. If you focus on that, you probably won't be competitive. And so they took our advice and delivered very competitive quotes, and United Healthcare responded with a 2.5% renewal. On the next page, per Mr. Moore's comments, we also received self-insured quotes from Blue Cross Blue Shield, United Healthcare, QualChoice, and HealthScope. And during the year, we've held numerous meetings with the clinically integrated networks that have been developed at both Baptist Health Physician Partners as well as St. Vincent's Arkansas Health Network. We've talked about this before to the board. We feel that this is part of healthcare reform that is going to help control cost. But both of these CINs are relatively new. And to date, they are only managing their respective populations. And so we'd like to see those develop a little bit further. And then we also found out in discussions with Blue Cross that because the city of Little Rock as a municipality is exempt from ERISA, we would have to apply to waive our ERISA exemption in order to be eligible to do one of these clinically integrated networks because of the Any Willing Provider legislation. So that's something I believe Mr. Carpenter is looking into. What are the pros and cons of the city doing that? All that said, and looking at the self-funded quotes with the significant downside risk, we felt it was prudent at this time to accept the 2.5% increase from United Healthcare. And per Mr. Moore's comments, something that we're doing with a lot of our other clients implementing risk management strategies, we think it's important that every employee, and eventually include spouse, get an annual physical. We have a significant number of employees who have not had a physical, do not know what their health risk factors are, and don't even have a primary care physician. So by developing that relationship with a primary care physician, initially through getting an adult physical, which is covered at 100% under the Affordable Care Act, I think it will position us a lot better in the future to look at self-funding. On the next page is a summary, or here we go, of the benefits. And the changes are to the base plan, and you can see we've increased the primary care physician office visit copay from $35 to $40. The specialist increased from 65 to 70, and then the virtual visits increased from 35 to 40. This is something new that we are really excited about, and this is included in the health insurance for the city. They're rolling it out this fall, and virtual visits, you know, you've heard a lot about telemedicine, and in Arkansas, in the most recent legislature, a law was passed authorizing Arkansas. We were the last state, by the way, to have telemedicine. So the employees and their family members will now be able to go online. There are two options, Doctor on Demand and I Am Well, and have a telemedicine, or better yet, a video conference with a physician. They'll pay a copay to do that, but they don't have to go to the doctor's office and spend a day or half a day waiting to see a doctor. And we think it's going to be a real enhancement to the benefits. Other than those changes, everything stays the same. Any questions?
Tom, could you go back to, I think, the second page of what you showed us there?
Mm-hmm.
So
That's
I'm
it.
just curious if you can elaborate a little bit. So it looks like from May of 16 to June of 17, a 12-month calendar year, we had an 88% ratio, loss ratio, and the first 6 months of that 2017 actually went down to 76%. Can you tell me what the rationale is for then requesting a 15.2 or 3% increase?
So that's why I put the information up there about 2016.
Well, I understand, but
Yeah, so they were trying to recapture some of the loss they had in 2016 and carry that forward into 2018.
so instead, we're going to increase our copays.
$5. on the
Well, I
base
understand, but it's, I mean, I can remember when we had $20 copays, now we got $40 copays. Is that right?
plan. That, yes, sir, that
And a
predates-
$3,000 deductible when we used to have a $1,000 to a $1,500 deductible. Or for family, it's $5,000. That's, you know, that's a pretty substantial imposition on many of our employees. Did any of the self-insured quotes have anything that was comparable or gave us any
Well, they quoted
greater
the-
benefit from?
They quoted the existing benefits, and to give you an example, under Blue Advantage, Blue Cross, their quote, the total maximum cost all in was $21 million. It's a big delta from what we're talking about today. And so I just don't feel comfortable coming out of what we would consider to be a loosely managed health plan. And we want to get some things in place. We think the physical is a good start. And typically, when we do that kind of strategy, in year one, you're going to see an increase in utilization because people are going to the doctor. And when they go to the doctor, they get diagnosed with hypertension, prediabetes, other things, and they start taking medications. So the advantage of doing that under a fully insured plan is that we won't bear the cost of that. United Healthcare will.
And what did they do on pharmaceutical?
Pharmaceutical
Was that
stayed-
increased?
No, that stayed the same.
Okay, thank you. That answers my questions, but I think Director Fortson might have a question for you.
Tom, I'm trying to remember, did we not have a couple of catastrophic claims in 16?
We did.
So that may be the principal reason for the improvement. We were avoiding that in the past 6 months.
Yes, sir. We did not have the severity or the number of catastrophic claims that we did in 2016.
Are there any statistical illustrations, I suppose, of exactly how much of our loss ratio improvement can be attributed to health practices, because we've tried to increase some, and frequency and kind of claims we've had? Or is that a perceived relationship that we hope will pay off?
Well, when you talk about managing future healthcare costs, future healthcare premiums, trend is a combination of utilization. How many services are we using? And then inflation. How much more do they cost today than they did a year ago? We can control the cost to some degree, but it's really utilization that you want to try to get control of. And that is people using the healthcare system appropriately, getting the right care that they need in the right setting, and knowing their risk. Well, we know that if we can catch cancer in stage 1 or 2, as opposed to 3 or 4, then the outcome is much better and the cost is much less. But often today in Arkansas, people present with symptoms and are diagnosed with stage 4 cancer. And the outcomes are just not that good, and it's very expensive. So just knowing what your risk factors are, and then as you start to develop this strategy around healthcare management, what can we do to encourage people to be compliant? If you look at the data around a non-compliant diabetic versus a compliant diabetic, it's dramatic. And so we want to encourage our people to do the things that they need to do. And I think starting with a physical is the first step.
And of course, physicals will uncover this, but as I recall, we discussed last year programs to attack obesity problems and smoking cessation programs. Have those continued to be implemented?
We do have the obesity program. It's a weight loss program through United Healthcare that's available to the employees on a voluntary basis. So that will continue to be part of it. And that really, when you look at what's going on with the health here in Arkansas and around the country, that's really the big problem. You know, when you look at Arkansas, where one of every 3 Arkansas adults is considered obese, and that is a big driver of healthcare cost. So we'll continue to work with the city around those type of programs.
Tom, you mentioned in here that Blue Cross Blue Shield and Qual Choice had much more competitive quotes. What did they respond with? I mean, did we get the lowest? I mean, was by renewing with the United Healthcare, is that lower than what Blue Cross Blue Shield and Qual Choice quoted? Or
Well,
is it, or were theirs lower and you're just electing to option?
No,
extend the
2.5%.
option.
2.5% was the lowest bid.
Pardon?
2.5% was the lowest on the base plan, but the benefits were slightly different.
I see.
For example, Blue Cross's specialty copay only covered the consult. Any other services provided during that visit were paid under the coinsurance. And so you would have a copay plus 20%, where if United Healthcare, it's just copay. So there were some subtle differences in some of the benefits. A lot of that's just Health Advantage is the Blue Cross plan that they proposed, and it's filed with the state with some of those differences.
How about Qual Choice?
Qual Choice came in a little bit above that.
I see. Okay, thank you. Director Hines, you're next, please.
Could you go to the next slide? Or actually the one with all the copays and maybe the third one. So when we start looking at the annual out-of-pocket up to deductible, I mean, not the annual out-of-pocket, the annual deductible going up to $5,000. We switched at our company over to an HSA plan 3 years ago, and my max with an HSA with a catastrophic plan, we have a $4,000 deductible for a family, and then it pays 100% after that. So why didn't we, when we start seeing annual deductibles this high, why isn't an HSA plan where we flip? And you really want to flip the script on some of that. It puts the healthcare cost back, and the patient really realizes what their cost of healthcare is. So why wasn't an HSA viable with these high deductibles we're seeing?
Well, the problem, and we do a lot of HSA type plans with clients, so we work a lot with that. The thing with an HSA for the average working American, so let's say you have a $2,000 deductible as an individual. January 1, nothing's covered other than routine preventive until you satisfy that deductible. And so if the average working American doesn't have discretionary income to make a contribution to their health savings account and/or their employer to help them fund that account.
And what we do in our company is each year at the new calendar year, our company puts a certain amount towards our deductible in our account. Because when we found out was that when we went to the HSA, we could buy the catastrophic policy, and then our company, for if you had a family, they'd put $3,000 towards your $4,000 deductible into your account to use through the first half of the year. And so I'm trying to wrap my hands around when we start seeing this high, why? Because there's a trade-off point when you're looking at these programs. So I was just curious as to why HSA, if we could get the catastrophic plan, how much, is there not enough money left over to go towards deductible? Or, I think that's just kind of the question I had, is why is that not a viable option?
We can look at that. The point I was making is it's very difficult for a lot of people, January 1, if they have to come up with $400 or $500 to get a prescription filled, because it's not covered until the deductible is satisfied. And if you have money in your HSA, or you can afford to put money in HSA, I think those plans are great. But if you don't,
Well, that's what I'm saying. Without the company or the city making a contribution to start off against the deductible, I agree with you, it's not viable. But we saw a considerable reduction by going to the high deductible plan. And it's a paradigm shift for somebody that's been, going to a high deductible plan. It's kind of like healthcare when I was a kid, where you went in, you paid the doctor until you satisfied your deductible. So from that standpoint, it's a little different, because when we went to this, the copay situation, you see utilizations go up, and I think that's probably part of the reason the higher deductibles. One thing we experienced this year is we went to a split deductible, because we found out once a family satisfied the $4,000, since it paid 100%, our utilization went off the charts. So now we've kind of changed up to get our utilization down, because we actually probably had people going to the doc just because they knew they didn't have any out of pocket. So, but I was just curious as to why an HSA, when we start seeing deductibles that high, wasn't viable.
And we can certainly look at it in the future. I mean, we used it a lot with other clients. Again, the concern is that people might not get the necessary health care they need because they simply can't afford it. Mm-hmm. And then we end up in the emergency room, and we have an inpatient admission, and we have an expensive claim that could have been avoided. But if there's interest, we can certainly look at that in the future.
Okay, thank you.
Director Campiris, you're recognized, please. Oh, you just turned yourself off. If you push it again.
Okay, thank you. Can you go back to this slide before this? I think getting this down to 2.5%, I mean, actuarially, that's got to be a pretty good win for you, and I appreciate what you did. I really think in the future, having the doctors have to be responsible, having skin in the game is going to be the way we all have to be taken care of. And this still goes back to the old system. I mean, it's the same sort of deal where you pay for a service and then you have a deductible. When do you think that the clinically integrated networks will be mature enough to start being a viable alternative for us? Because the problem, as you know and I know, I mean, if you look at the last 2 years, going from 106, going a 6% increase over premiums down where they're making that much money on the premiums, all they're going to have to say is if we have one bad year, then we'll be at 12 or 15% next year. Because I know, I mean, they tried to sneak one by you the first time and to get the 15%, and that's, you know, it's the game y'all play, or they play. But my worry is that a year from now when you're here, if we happen to have, unfortunately, some catastrophic events, then we're really looking, and I'm looking long-term to try to find something that is manageable for us to manage, because you're putting the onus, or you're putting the responsibility on the physicians and the healthcare networks. So when do you think they're going to be mature enough that they're a viable alternative?
I would hope by 2019. I think another year. And talking to the folks with both of the networks, they are still filling some holes in their networks. And I think you need to kind of get, you need to wrap your brain around a higher performing narrow network. And then today in Arkansas, all the networks are wide open. They're just big open panels. And so to do what you're talking about, I think you're going to need to partner with a group, one or the other, and bargain with them to where they've got some downside risk, not just the city, and so that they're managing to better outcomes, and they're not doing things that are unnecessary. And but I would think, Director Compeers, that 2019, they should be ready. They're going to start taking other employer populations under management going into 2018. I don't know who or who's going to do what, but that'll give us an opportunity to see how that works before we step into it.
And then Tom, wrong Tom, what about, can we get a waiver from our ERISA if we wanted to use a clinical integrated network?
I don't know the answer to that.
Succinct answer.
I think, and we have talked about it, and I've asked Tom for his thoughts on that, and at the end of the day, we can, it's just going to be what we give up. And so we're really going to look at the advantages versus the disadvantages of it, and that's the conversation we're already having.
Okay, thank you.
And I believe the city of Hot Springs has done that, so that might be a.
Tom, on that virtual physician concept that you mentioned, I presume a physician can write a prescription based on that visual contact. Is that correct or incorrect?
Some drugs. So there are some limitations there. They can also, on doctor on demand, order lab, which is unique compared to some of the other telemedicine. And just to give you, Walmart is bringing doctor on demand, the same thing, that virtual visit that we're going to have to their employees. And another client of mine, ABF, ArcBest, is doing the same January 1. Telemedicine is one of those, it's not a panacea, it's not going to solve all our problems, but it's going to be part of the solution to give people a reasonable access that's convenient.
Is that a decision that the doctor makes, or is that a decision that the plan makes on whether or not the doctor can write a prescription for certain kinds of conditions? In other words, if I got a sore throat and, you know, I've got congestion and can I call the doctor and he can do a visual, whatever, I guess, what do you get on your cell phone or whatever you do, and
Yeah, you can do it on a smartphone, you can do it on your desktop.
smartphone, and he can prescribe?
Yeah.
So is that set by the plan or by the doctor?
I think it's set by law, what physicians could prescribe.
Well, I know. Thank you, doctor. I'm glad you did that for me. No,
I think the opioids and those Class C drugs, I don't know what they call them.
The other question I have, and this may be an issue negotiating with United Healthcare, but you know, I don't know, and I want to disclose all my medical conditions, but I have a history of high cholesterol, and so I take a cholesterol medicine that was brand name Vytorin, some people are probably on it that are here in the room. And the doctor said, or the pharmacist said to me, well, Mark, man, you know, next month that's going to go generic and you're going to save a lot of money. And the $70 a month you're paying for that, it's going to go generic, so you're going to save a lot of money on that. So I go the next month and I get my prescription and it's $70, and I go, well, I thought the generic was starting, and he looked at it and he says, well, yeah, it is the generic. So United Healthcare is now charging the same amount of money for the generic as they were charging for the
Right.
brand name, which sounds to me like United Healthcare is getting the great benefit out of that as opposed to the patient.
Okay, well,
Can we negotiate those kinds of things?
we can. Let me tell you what happens with generics. When they first come to market as a generic, it's not uncommon to see the cost go up because they
Right.
know there's a period of time before the competition is going to be able to come to market with a equivalent. And so they're profit
they-
skimming. They're profit skimming, the manufacturer is.
Yeah, I understand that process,
so
but
once you get enough-
but now that there's a generic out there, they're charging the same amount of money as they
Well,
would for the
that's
regular.
what I'm saying. So when a drug comes to market as a generic, it's not uncommon for the cost to actually go up until other competitors come in with equivalent drugs to drive the cost back down. We could spend the rest of the night and the rest of the week talking about the pharmacy and some of the things that's going on. And that's something that when we get to a self-funded plan that we'll have a lot more control over. But yeah, it's a very interesting industry.
Thank you. Okay, I guess that concludes all the questions. Thank you very
Okay.
much.
Thank you.
All right, we can look at the next page, and let me see if anybody's got any questions on items 10 through 14.
I have one on 11.
Go ahead, Tom.
11 doesn't need to be part of the consent agenda. It's going to be a public hearing for the sale of the bonds. And so that should be listed that way. I didn't get the correct information to Susan, I apologize.
All right, very good. All right. If there are no other questions on this page, let's look at items 15 through 18. Director Adcock.
Yes, Mr. Moore, I'd like a presentation on 15 and 16, please.
Our planning director, Mr. Collins.
Mr. Collins, I know that we put in some special regulations on special event centers. Has this applicant followed all those requirements?
Yes, Director Adcock, they meet the requirements. They turned in a site plan, and then we met with them, and through the planning process, there was some requirements that was made as far as location of dumpsters and parking. And you're correct, this is coming through as an event center. They're going to keep the current uses that are there, which is...
What are the current uses? please?
Well, it's commercial, general commercial, so right now there's an existing auto repair garage at that location, office warehouse, and a janitorial service. So right now, with the uses that are there in the event center by code, our parking spaces would be about 68, and they're providing 69. If you could switch over to the sketch plan and kind of see some of the layout there. And in that application, they did note some of the key items I'm sure you're interested in, is the hours of operation. They put in there 8 a.m. to 11 p.m. Sunday through Thursday, and 8 a.m. to 2 a.m. Friday and Saturday. Events for lease. They did go in there that say there'll be no alcohol sales on site, but they will allow it to be brought in. And they also put in there no food preparation on site. It would be done by catering. So, in the event, if there's food for that event, they would have to be catered in.
Okay. Is there any age or any type of restrictions on what type of parties and stuff they can have?
There's no type of restrictions on the parties. The events they put down that they're looking to do is just wedding, corporate events, birthday celebrations, and special occasions. So, and we didn't place any limitations at the planning commission.
Okay. Well, one thing that concerns me is what we brought up when we started this with special events was the 16, 17-year-old that has a birthday party there and that they can bring alcohol in. But they can bring alcohol in.
No, not on those. I mean, that's a law situation, you know, and so that is a restricted use, you know, that's, you know, against the law for underage, but there's not going to be any sold on site. It would have to be brought in by the event itself.
But they can bring it in.
If they are, you know, of age and of, you know, of use, yes, they can.
Okay. Did the neighborhood approve this?
The neighborhood was sent all notifications out. I don't have any, there was nobody present. The applicant was present, but there was no registered objectors at the planning commission.
Okay. Was the Westwood neighborhood as well as the John Barrow neighborhood both notified? Or Western Hills?
I'll have to check on those. I know the Westwood was, I can't speak for the John Barrow.
Okay, thank
Director
you.
Wright's nodding yes. I can't remember without getting that letter, but I can get that, all the ones
Okay.
that was notified to you.
Okay, and number 16, please.
16, that's located at 9010 Alero Springs Road. Pull up the zoning map. As you can see, the current zoning was R2, and that was just how it was brought into the city when it got to Annex 10. Currently, it's a commercial use, and so that's what they're looking to go for in this plan development is commercial, is just general C3 use on it. It's been used as several things. You know, I think a church, you know, some other, you know, commercial uses.
It was the old Step-Up Center.
Yeah, and there's a school right to the north. You bring up the sketch plan.
Baseline Elementary is right beside
Yeah.
it.
So what he's looking to do on this is to rezone it. Right now, there's nothing in there. You know, it's vacant. To try to lease and or sell the property for this. You know, the concerns that we have is right now typically it's just the use. I mean, the applicant brought up several scenarios if he could piece this stuff off and break the building up and try to lease to different entities. And so our only comment, and we're in support of this, would be whatever the use is decided and they come in, be it a small restaurant or an office space or whatever, that we would have to look at the signage and the parking spaces at that time for the use and available on the sign, and they were agreeable to that. You know, so it's going to need to stand on its own and come back forward in the site plan review process.
It was used for youth programs in the very beginning, and so it does not have a lots of parking places.
There's not, a lot of that receiver says 45.21, that's more of a loading area that was there. And so, you know, it's going to be tight on parking, and like I say, it depends on the use that comes in. And we'll have to evaluate that when it does come in.
And of course, and being that close to schools, that can't be alcohol or other things, right?
That's correct. There's a limit based upon that, not necessarily on our zoning, but on the ABC.
Okay, thank you.
Director Wright, you're recognized, please.
Thank you. Mayor and the board, regarding item 15, I attended the John Barrow Neighborhood Association meeting at their request when this item was discussed, and I learned something that I did not know, that this has always been an event center for many, many years. And mainly it holds wedding receptions. Very nice facility. I looked at the pictures and I was just shocked, because you would never think that that is what that building was. But the Neighborhood Association did meet on this, and I received a call telling me that they were in support of it because of the way it has always been managed and the assurances that the gentleman gave regarding his property and how they wanted it to be utilized. So, but Joan, it has always been an event center, and I never knew that.
Anything else, Director Wright?
Nope, that's it, Mayor.
All right, Director Wyrick, you're recognized, please.
Thank you. Mine is on item number 15 as well. In regards to the alcohol, is there is there an ABC permit requirement for bringing in alcohol to an event center?
The ABC permit is for the sale of alcohol. We'll have to get more specific with either city attorney's office or the police, but I believe that would be the city to police, as far as that goes, until the ABC permit is issued, and that's the enforcement. And their permit issuance is based upon the sale of alcohol.
Okay. Mr. Moore, I've read some information that says that the city is looking at clubs and event centers and maybe shoring up what our plans are, what our criteria is. Have we worked on that? And are you bringing anything else forward to the board to approve in regards to event center and clubs?
I feel pretty good about, and you all helped put the one that's on the books now as far as special event centers. I think we have some good parameters in place as far as distance and things like that. Where we were really focusing on are locations that are acting like special event centers but have not gone through our process. So that's a real focus of Tom's office and LRPD, including the Vice folks. And in fact, that's really how we were able to stop this last one a few weeks ago, as we were all sitting around the table and the Vice people were passing out flyers about this event that was going on Thursday night and Saturday night, and they weren't permitted. In fact, the fire department had told them they couldn't operate in the building. And so I think the new process we have in place is working, but that's really on a focus. What people do is they find an old restaurant or old lounge or a vacant building, and they put out a flyer on Facebook that we're having a party here Thursday night, and alcohol, you can buy your alcohol, and they were even they're going to be selling food and didn't even have the proper kitchen equipment and all. So our focus really is on the ones that are operating like special event centers and have not gone through this process like this one on Colonel Glenn.
So Doris was saying that this is always operated as an event center. Is that why it's coming before us now, is because we determined that that's what they're doing?
Well, I think they came in and said, this is what we'd like to do. And we said, well, you might have been operating like that, but you really got to go through a process.
Okay, thank you.
All right, you can turn the page, and we've got a couple items on there as separate items. Any questions about either of those two? Director Adcock on number 19.
As the board is aware, the city adopted in 2013 a defined benefit pension plan for our non-uniform employees. Since it's been in place, there's things that have come up that we need to address. So no changes in benefits. This plan details. This is really just to clean up some of the things that we've learned over the last 3 or 4 years. And Jody Carrero is here if you'd like to come forward and answer any specific question. Jody.
Jody, my main thing was, does this have anything to do with the money that we have for the employees? And is this increase their benefits, or is this just leaving their benefits? And what's the cleanup that we're doing?
Well, the cleanup is, first, good evening, good to be here with you all. But the cleanup is, it wasn't clear about disability benefits. There were some things in the plan language that weren't as clear as they could have been. So we've had some questions, making sure that people got the benefits that they deserved and were in the plan. There was some language for the agencies that have adopted the defined benefit, the DB 14. plan, as we call it. So those agencies signed agreements, but there wasn't corresponding language in the plan document, so we made sure that those two things matched. And then most of them were typographical or numbering issues so that we didn't have a question. As Mr. Moore said, there's no changes to benefits, no changes in the way the plan will be operated with this suggested restatement.
Have we met with any employees, groups, or anything to discuss this?
Not with employee groups. The committee that we have, the trustees of the plan, have been through these changes. I mean, we've collected a list over a couple of years of these minor things that, none of them, since nothing changed any benefits, they didn't feel like they needed to talk to all employees. It was just to clarify so that no one was confused by the plan.
Okay, thank you.
Yes, ma'am.
Thank you, Jody. That concludes the items on our agenda. You'll note that one of the documents that you received on your desk is this business plan of Springer and Springer, which really harkens back to item 8 on our resolutions that are on our consent agenda. This is dealing with some property that we own and a construction of duplexes, I believe that is for a variety of different potential occupants that are disabled, it looks like. So I just wanted to let you know that's what this refers to. Okay, very good.
This is duplexes. They're going to build 30 of them in the neighborhoods. And this is the first two. And these first two do not have to go through the Planning Commission because they're already zoned for duplexes. And these will serve people not with disabilities, but people that are in wheelchairs. And if you notice the pictures, I had never seen this before, but if you have a person that is in a wheelchair and you can't get them up, it has like a conveyor belt across the room from one room to another, and you hook them on that belt, and they can go from one room to the other without being in a wheelchair. And so this is for certain people of disabilities, but they have to be in a wheelchair or full-time. And these, instead of just being the apartments or the houses being built for disabilities, all these have the lower cabinets and everything is built instead of just a bathroom that is for disabled people. They're going to build these first two. The land is coming through the land bank. They are throughout, I think, Ward 1 and Ward 2, and there may be one in Ward 6, but it's all gone through the land bank and through the Community Housing Board, and I think it'll be a wonderful addition to our neighborhoods.
Very good. Director Campuris, you're recognized, please.
Three things. The first is 4 o'clock on Sunday. We're going to officially open the Vogel Sports Garden, so you all are invited. I think you've gotten invitations. Secondly, I think that we owe Bruce and his staff a great vote of thanks for the great job they did with the Central High event. It was beautifully coordinated, well done. I told someone coming in today that the only problem is that most of the things that people heard were preaching to the choir rather than the people who needed it. But that's, you can only do what you can do. Scott did a wonderful job. I thought the mayor's remarks yesterday were his best efforts ever in that sort of thing. And he was only a minute and a half over what he was supposed to do. So that was
6 minutes.
6.5. So I thought it was a great event, but I think you did a great job, Bruce, for and represented us well, and I think it went off flawlessly. I'm sure that that was just the appearance that probably behind the scenes, a lot of people were doing a lot of things that I know that you could have taken over City Hall yesterday because there was nobody at City Hall. You could have just walked in here and taken it over. Everybody was at Central High School, but that was fine. The third thing is Tom sent out his memorandum yesterday about contributions. And I read it, and then I read it again, then I read it a third time. And I think that it's something that at least I think the board needs to discuss and decide how we're going to proceed on. It is, it is something I think we need to discuss. Now, whether we do it today or Monday or when we do it, I don't know. But I think in our planning, if we don't do it today, we need to leave time Monday to think about it and plan on it, and that's probably the best way of doing it. I know this is a little unorthodox, but when we do it, I think that we ought to probably do it without the mayor being here. I mean,
Well, that's fine one way or the other. I mean, it affects everybody that's running for office, so it's not just.
I know it is one of the most. The more you read it, and you first of all, at least on my reading, my first thought, well, this is pretty straightforward. And then the more you read it, and the more you think that four of us, it doesn't involve. I mean, at least right now, but 7 people, it involves dearly in what's happening. And so, I think that in the end, we have to do whatever it takes to make it a level playing field for people who run for office, but people who are in office. And so when you read it, that's at least the way I've looked at it, is that this is not an issue about who is running for mayor, but how you set up for any of the seats that will be open next November. So, I mean, it's, we can discuss it tonight. We can wait a week if people have not gotten their thoughts.
Does anyone else wish to talk about this issue? Okay, I'm asking because I have multiple lights on. Director Wyrick, did you want to talk about this issue? A different issue. All right, Director Hendricks, you're next, please.
Thank you. I wanted to ask Tom, you just handed this to me today, so listening to what Dean is saying, is this something we got to vote on or we got to change? You just handed this to me. He said he had read his a couple of days ago,
No, we got it last night.
last night.
It was sent by email last night to the board of directors, Director Hendricks. There's really not anything to vote on. There were 4 recommendations on how to proceed. There's really only one recommendation I've made, and basically was the one I was intending to follow through on unless I heard otherwise.
So it's nothing we have to vote on.
Well, no, can I beg to differ with that? There are options that we have as a board that we can initiate.
Right.
And that's different than saying that it's not like one of the things we have up here where you have to vote yes or no. You can accept this report and do nothing. But as a board, we have to be able to say, we accept these recommendations and it's going to stand where it is, or we're going to do A, B, or C. And there are multiple things that, at least to my reading, now I'll read it again tonight, and there may be F and G and H tomorrow.
Okay, I'm talking to Tom. Tom, we can or cannot do not vote on this piece of paper? That's my question to you.
Director Hendricks.
After reading it, make it short.
After reading it, somebody's going to have to say what to do next.
Okay. So this is not mandatory. Okay.
Director Adcock, you're recognized, please.
Well, I would like to discuss it. I choose that we do something about this. Tom, you also asked, I think, all of us to respond to you. Did you get everyone's response?
I got a response from you.
That's the only one you got?
The mayor talked to me today at the mayor policy meeting.
Okay. Well, I think we should do something, because if you're running for the city board, the beginning of your campaign should not be, how do I get around doing what the city board's rules and regulations are? I think that when we pass those, we pass them for a very good reason, and that was because we had people campaigning for a whole year before the election, and you couldn't do anything up here because everyone was campaigning, because everybody running against them was campaigning. So we set up that rule to give everyone a level playing field, that everyone would start campaigning, raising money and everything at the same time. And yes, this time it's in the mayor's race, but the rest of you, except Dean and Jean and I, will be running this next year. And it would not be fair to you if in the next week or two, people start campaigning and raising funds to run against you, and you can't do it until next June because that's what our rules say. So I think anyone wanting to run for the board or running for mayor should follow the rules set up by the city, by this board, or former board.
Director Hines.
Thank you, Mayor. One of the things, because I'm probably one of the more junior members on the board, having only starting to serve my second term, and when we signed up and got our packets, Susan's office gave us a packet. It had all of the Little Rock, had the state campaign finance and the Little Rock campaign finance, which was much more restrictive as I read through it. And then getting the background from some others as to why it was done, it does give me concern that somebody has sought to circumvent city ordinance by using what's essentially a loophole that I think may or may not have, according to Tom's, has not been created, but some folks decided to have interpreted it that way. Tom, I think the question is, does this need to go to the Attorney General's office for an opinion or back to the Ethics Commission? Because evidently whoever is giving the Ethics Commission legal counsel didn't catch this in the light that you did.
Director Hines, I was going to, unless told not to do so, I was going to seek an advisory opinion from the Arkansas Ethics Commission. The commission is given the authority to issue advisory opinions, and it has a timeline for doing so. They have to do it within 90 days. The letter order that I included in the packet indicated that they did not have jurisdiction over the specific issue dealing with exploratory committees, but they never mentioned the statute nor the ordinance that deals with that particular issue. And I think they need to at least tell us why they don't apply, and I think they do apply, and so that's what I would have done. I would send a letter to the Ethics Commission asking for an advisory opinion about the applicability of our ordinance on timing in light of the statute that allows us to set that type of timing and the statute that otherwise sets a time frame for exploratory committees.
Okay. And one quick question, because I know we've had campaign finance law change and is part of the result. So did the old the state campaign finance law have an exploratory committee subsection in it, or was that something that was added in the new legislation, the new ethics legislation?
As I understand it, the 2014 Act had a reference, but it did not repeal the express provision in that same subchapter that deals with the three things that local governments can be more restrictive on.
Okay.
One about the amount of contributions, which is of some serious constitutional question in light of a previous decision by the Eighth Circuit on that point. One is about the time frame for collections, and one is about certain expenditures with the collections.
Right. And so just to get my understanding, that the bridge with an exploratory committee is how it violates our ordinance is the fact that ultimately that money ends up in the person's campaign, or it
comes
at the end
from the
it may be
definition.
whether it's exploratory or not. At the end of the day, it's given to the to the candidate once they announce their run. So it's essentially raising campaign funds outside the.
Right, it's
the
the
ordinance.
definition of contribution of raising of monies for a committee, which would include any kind of committee, including an exploratory committee.
And then one other question, because I think, and I interpreted as a layperson, our ordinance on carryover surplus funds, as I read it as a layperson, it looked like you couldn't have any carryover or surplus funds. I didn't realize there was a splitting of the hairs with that. So in the last two campaigns, I've donated all mine to charity. So does the fact that we had a change in that ruling that's not covered by our, clearly drawn out in our ordinance, create the folks that are doing exploratory committees saying that an incumbent has an advantage because of that carryover? Does that have any impact?
I'm not quite sure how to answer that. What I can say is that in 2010, the question came up as to whether the subsection that limited how a member of this board could spend excess funds still applied in light of the changes in state law about the expenditure of excess funds and carryover funds, which are two different things and defined differently. And that's why I included a copy of that memorandum with the materials that I sent yesterday, because at that point, I said that the state law had preempted what we can do because the dealing with excess funds or carryover funds is not one of the issues that the city is given the authority, or any city or county, not just Little Rock, given the authority to be more restrictive on.
Okay, so that's what's changed. So, all right, thank you. And I don't think that was the opinion at the time we created those ordinances back.
No, the ordinances precede a whole lot of these things.
Okay, all right, thank you.
Director Fortson.
Well, first, I agree with Director Campuris. I think we need to discuss this and decide what our course of action is. I think, going from personal experience, I've been on the ballot 3 times. I've never had the luxury some of you had of running unopposed. So I know the process beginning in June, in my opinion, allows a lot of adequate time to raise funds and get out and get the message across. As an at-large director, I've run citywide. I think I tallied, and I'm sure Director Adcock, like nights out, outdid me, but I tallied 46 or 47 meetings that I went to in September and October last year as part of that campaigning. I think one of the things, I was not on the board when this was all put on the books by the new party. I was a citizen who kept up with things, and at the time I thought it was sort of restrictive. But I think one of the things we have to consider is we are essentially in session year-round. We are constantly making law that affects people who have special interests. We just tonight set public hearings for October 17th for 2 applications on zoning matters that may be contentious when they come in here. The reason for the restriction was to limit the opportunities for undue influence by campaign contributions over a longer period of time. Just the opportunity for pressures to be brought relative to campaigning over a 2-year period or an 18-month period, I think puts an extra burden on the process. Last year, when I was a candidate for re-election during the period from June through November, I received 2 unsolicited contributions from people who had matters pending before this board, which I returned. I don't think either of them probably intended to influence me, but there's the appearance of impropriety when that happens. And I think when you extend it out to a 2-year period, there's just a whole lot more opportunity for an appearance of impropriety. I think 6 months is adequate, but I think, and that's just my top of the head reading, Dr. Campuris. I read this online last night. I haven't studied any further, but I think it requires some study and a plan of action from this board.
Okay, Director Hendricks.
I just wanted to comment on what Lance was asking about that exploratory committee that collects funds. Is it anywhere that says that whoever serves on that committee cannot run for office? If not, I didn't see it.
An exploratory committee is defined as a person, which can be an individual.
No. I said, does it say that no one that's on that committee can run for
The
office?
exploratory committee is expressly for a person to run for a office.
Okay, but still, what I hear Lance asking is that, should that person run for office? Is it anywhere in writing that that person that's a member of that committee that's collecting money ahead of an election, can that person run for office?
They're collecting the money for a specific person to run for office.
I know that, Tom. I've run many
Yes.
times. I know all about politics. And the answer is no.
Director Adcock, you're recognized, please.
Tom, what is the difference in surplus and carryover funds?
I don't have.
Because
the-
I had money left over every time, and I didn't know if it was one kind of funds, or I know that it was just money that I had left and I gave away. So what's the difference in surplus funds and carryover funds?
Director Adcock, it's in the memorandum, off the top of my head. I do not.
I know,
remember.
but people watching this have not got a nice copy of your memorandum, so tell them, and I'll just listen. What is the difference in surplus and carryover funds?
They're statutory definitions.
And should we change ours to be very specific that you can't carry over surplus or carry over funds? They have to be given, the three things that we are told is they can be given back to the person, they can be given to the city, or they can be given to a nonprofit.
That's what the ordinance says, yes. The statute does not say that. The statute would allow them to be maintained. They have to be reported. You're supposed to start reporting them relatively immediately after the election, and then you keep filing reports. Right now, I don't remember if they're annual or quarterly. And I think you have to file quarterly reports if any monies are expended, to say what had happened to those reports. And if you haven't expended any money, if you have a sum of money that nothing's been touched, then you have to report annually what the amount of money is.
If I'm not mistaken, whenever we passed this ordinance that we passed here at the city board, we meant for all funds, I don't care what you call them, all funds to be eliminated so that there's no person that has an advantage over anyone else, since we tell other people you cannot collect funds except from June until the campaign is over with.
That was the intent of the board, as I remember the discussion at the time. Yes, ma'am.
There's a few of us, Dean Campiris and BJ and I, that was here back when you had to campaign constantly because somebody running against you was always out there campaigning. And so you was always campaigning. And with all the neighborhood meetings we have and everything else, I can assure you that 3 or 4 months is plenty of time to campaign. So I'd like for us to address this and do something about it so our ordinance stands.
Director Wright, you're recognized, please.
Well, Mayor, I just wanted to give Mr. Carpenter my input as to how I view this. I am in favor of the 6-month campaign starting in June, because I don't want to have to focus on that for a whole year. It's very distracting. And but I also don't want to be at a disadvantage. So whatever action we need to take as a board to enforce the ordinance as we have it currently, that's the position that I hold. So everybody's on the same playing field.
Director Peck.
Thank you, Mr. Mayor. Everybody's pretty much said what I am thinking, and like Director Campiris said, I think we should discuss this Monday. Thank you. I did receive the email, just looked at it very briefly. Agree definitely with Director Forts and Director Adcock and Director Wright. So can we put this on the agenda to discuss on Monday? Do we need to do any? Can we do that?
Sure, if that's the will of the board. And Tom, if, as our lawyer, if you have a recommendation, I know you laid out some options. If you have a recommendation, I'd like you to be prepared to give us whatever that recommendation is.
Yes, sir.
Okay, anyone else want to continue to comment? Yes, Director Campiris.
Tom, one thing, having read this again, tell me where our options are of resolving the conflict between our ordinance and the state law. Where does it have to go? Is the Ethics Committee where it has to go?
Director Campiris, the way that the memo stated, I think that asking the advisory opinion from the Ethics Committee is the thing to do, because the decision, which you've got a copy of, that they entered in the complaint that was made a blanket statement that there's a 2-year period of time and did not discuss the statute that allows cities to set more restrictive periods of time, nor did it discuss our ordinance. And in fact, it said it didn't have jurisdiction over our ordinance, when in fact it does, because it was within the same subchapter that gives the commission jurisdiction. The only other way I know that you can get an answer is to file a declaratory judgment action. And even then, if you haven't asked the commission for a response specifically to that question, I think we would be hamstrung.
So step one is that we have to get them to realize there is a problem.
Or say that there is or say that there's not. We just need to know how they would say it and tell us about the statute's interaction with the ordinance. Yes.
Okay, thank you.
Tom, how does the Attorney General and the request for an opinion play into that issue?
Mayor, I think that the Attorney General could be requested an opinion if that's the interest. I think you've got the authority to ask for an opinion. I'm not sure who else does. And of course, any legislator has the authority to ask for an opinion. Maybe all members of the board have the authority, with the exception of the FOI opinion as to whether a personnel record is releasable. It's a very limited group of people that are allowed to ask the Attorney General for an opinion.
Director Hines, you have another comment?
I think I read it. So the only part of our ordinance that you think has been nullified by not complying with the state law is the carryover funds issue, right? The carryover surplus funds.
Limit.
And the
There is
limit.
a part of our ordinance that allows us to make a stricter limit on campaign contribution amounts.
Right.
That has not been challenged. There was an attempt to do so, but there was nobody brought our ordinance up in place at the time, and we didn't have an amount. I think that issue is at risk in light of all the case law that's gone on, particularly since Citizens United, about contribution amounts. In terms of the authority that cities are expressly given in election areas to be more restrictive, there's only 3, and it does not include how to deal with carryover funds or surplus funds.
Okay.
So the state statute controls, because the city can't pass a statute, an ordinance that's in direct conflict with the state statute.
Okay. Thank you.
Director Wyrick.
I'd not read the memorandum. That's the reason why I didn't have any comments before. I was in Perry County, and I don't have Wi-Fi or internet up there. But having heard from you all that have read it, it sounds like that we need to take further consideration of it, and Monday night is good for me. I'll read it between now and Monday. But anyway, it sounds like we do need to take some action, if nothing more than what Tom is suggesting, to go to the Ethics Commission, or maybe to the Attorney General, or maybe both. I'm not sure. But I had another issue.
Okay, let me,
You keep turning me off, is the reason why I keep hitting my button again.
okay, let me
so-
go ahead and I'll leave you on.
Okay.
Director Adcock.
Tom, if I remember right, we did not put any penalty into that ordinance. So if we find that our ordinance stands, would these 2 individuals have to then return the funds that they have collected for campaign funds? So what would be done?
That's kind of 2 questions, Director Addick. There's general sanction ordinance, Section 1-9 of the code, that imposes sanctions for violations of the city code. So that is there. However, because of the interplay with the state statute, the city's sanction would fall and the state sanction for violation of the campaign finance laws would control. And so it makes it a Class A misdemeanor, which is $2,500 or up to a year in jail.
Okay.
I want to tell you, though, that as I mentioned in the memorandum, with the current status of what the Ethics Commission has said, I don't think any prosecutor can ethically bring a prosecution right now. I confirmed that with Mr. Jagley this afternoon.
So it would be up to the individuals to do any type of returns or anything. We
Well-
would have no part in it.
There's not going to be a prosecution, right?
Well,
Thank you.
I think her question was, what happens if people have already raised money?
Yeah. Do they
And the
have to give it
decision is
back?
that it was not supposed to be done.
It depends on how it's been done, Mayor. I mean, see, the odd thing is that although the state statute doesn't seem to bar exploratory committees by incumbents, the state regulations from the Ethics Commission definitely bar exploratory committees by incumbents. The one possible exception is that a member of this board could run for mayor, and that would be deemed a different office, and they could probably get an exploratory committee for that. So, I mean, that's that aspect of it. I actually forgot the thrust of the question.
Well, I don't think that was quite the thrust of the question. The question is that at least there's some understanding that candidates who've declared their interest or their intention to run have already raised money. And I think Director Adcock was saying, if in fact that violates city ordinance and that's the position that ultimately is resolved here, one version or another, what happens with the situation where they've raised money? Do they?
I think that's something, right now, the Ethics Commission has said that you, for an exploratory committee, can raise funds up to 2 years prior to the election. So until
we
they
understand-
address
I think-
that issue, what can be done is not even an issue to them at this point.
Well, I understand that. Never mind. I mean, under the current situation, I guess the issue is, based on your opinion, you made some fairly complete legal analysis of the issue relative to state statute, which I guess is where you've led us to the basis of making a recommendation of what ought to be done next, which certainly will be discussed on Monday. And perhaps that's ultimately a decision for the Ethics Commission to have to answer, is what happens if in fact your position is also agreed to by the Ethics Commission or whatever other body might be looking at this.
Yes, sir.
Okay, let's see. Director Wright, did you want to continue to comment on this?
That was, I think, want to turn me on? Director Adcock asked my question, and I'm kind of like you and her. I'm still not clear, but I'm somewhat clear. But it would not, there is no really penalty at this point for, say somebody wants to run for a board seat and they start raising money now.
Right now, under the order that the Ethics Commission has issued in a complaint filed against Mr. Saban, anyone eligible to have an exploratory committee can raise funds up to 2 years before the date of the election.
Director Hendricks.
You know, my comment is always bitter or sweet, but it seems like we're running like we're scared. But I think that with Joan and Dean and Fortune, they've been here, and I have too, so if you're thinking about running, just get busy and forget about all this other stuff, because it's in place unless somebody, I wouldn't waste my time worrying about somebody else getting money. In fact, I really don't even raise money. I don't even campaign. So take it after me. You don't even have to run. You don't even have to campaign. You don't have to beg for money.
Director Fortune.
Just one last question, make sure I understood what you said, Tom, that as things stand presently, if someone wants to oppose Director Hines for re-election, they can form an exploratory committee. They can raise funds. They can spend those funds, but he cannot.
Right.
That's what I thought you said.
Yeah, and that's one of the fundamental problems. Okay,
I have one quick question.
go ahead, Director Hines.
I'm trying not to go down a rabbit hole, but Tom, and that's, you know, on the one hand, we have a certain camp that's doing exploratory committees saying the incumbents have an unfair advantage. But what you've just told me is that the state has created an unfair advantage for somebody that's not an incumbent, being able to form an or is that because we have restricted ourselves from being able to raise funds. Is that the crux of it?
Selves in the ordinance.
Okay, that's what I'm trying to figure out, kind of, we've got contradictory stuff, but we've actually contravened our own ability to do that.
Y'all have stated, pursuant to a matter that was brought to you, no campaign financing contributions can be collected or solicited prior to June the 1st before the election. It's a little bit different for special elections, but June the 1st before the regular election. And so you're bound by that. The state statute on exploratory committees has been interpreted to be 2 years. And so it's the interplay between the statute and the ordinance that's the issue.
And we need like you said, we need to go back to the election commission to get a definite up or down on what they think, and then a declaratory judgment furtherance, correct?
Ethics Commission,
Ethics.
but yes.
Well, no, but if we go to the ethics commission and.
You had said election, and I was just, I'm sorry, I was just
I'm
clarifying
sorry.
Ethics
Yeah,
Commission.
Ethics Commission, I mean, so based on what they rule, then we still have other options. So I think, is there anything to ask them for an expedited opinion? I know they've got 90 days, but do you think they would take it into account that?
Director Hines, I don't know the answer to that, but I will tell you that through 30-something years of practicing law, the moment I ask a judge for an expedited opinion is the moment that I lose.
Right. Well, I didn't know. I mean, this is the Ethics Commission versus a judge, so, thank you, Tom.
Okay, Director Wyrick, you're recognized for another issue, please.
Okay, thank you. Mr. Moore, a couple of weeks ago, I had some neighborhood complaints about a block party that was happening, and they were creating roadblocks in the street. They had blocked people's drives where they had to go through other people's yards to get out of their home. They did get a petition, and there were signatures on it, but they blocked the street where people had not signed the petition. It was on like a major thoroughfare, and I just think that we need to look at the block party permits, and I need to understand the rationale behind them. And a block party, is that for the people that signed the petition? You know, if you have a block party and you only have 4 people, one next door to you and 2 across the street, and you're able to close a major thoroughfare, then that impedes traffic, and it also creates problems for individuals in the neighborhood. So if you would look into that, give me some details on what a block party is supposed to, how it's supposed to work. I think you pay $25 and you get some signatures, but who are those signatures from and for, and what are the limitations for a block party, and how do you determine which streets can close and which cannot? Apparently, this has been an event that they've put on every year. It's created issues because of it being on a major thoroughfare. So I think we need some details on a block party and how we should do that.
This medical.
Mm-hmm. Yep. Thank you.
Okay, it looks like that completes the information that we've got for today. So thank you all very much for coming.